Carotid artery disease is really plaque buildup in the walls of the carotid arteries. Carotid arteries are the two of the main arteries that supply blood to the brain. So when you have plaque buildup in those arteries, they can effectively narrow the artery and restrict blood flow to the brain. Some plaque may break off and travel to the brain and cause a stroke. So addressing symptoms of carotid artery stenosis early may mitigate risk factors for developing a stroke later on. Seeing patients with potential carotid artery disease, it's really important to start with a detailed history and physical exam. Specifically, we're looking for risk factors that may predispose patients to developing carotid artery disease. Workup usually begins with an ultrasound in the office to look for evidence of narrowing of the carotid artery. And if the narrowing is found to be severe, we may refer for additional imaging such as a CAT scan or MRI. So the problem with carotid artery disease is that most patients are asymptomatic. Symptoms really only start if you develop a stroke. So it's important to identify risk factors for carotid artery disease. The most common risk factors are age, over 60 years old, male sex, history of high blood pressure, diabetes, and smoking, as well as a family history of carotid artery disease or heart attacks. Seeing a patient after intervening and treating a problem that they've come to me with is really the most rewarding part about being a surgeon and a doctor. The reason I went into surgery was to help patients and be able to see the effects of the treatment that we perform. And it's really gratifying when we can improve their quality of life or prevent a bad outcome in the future. And so that's really the most meaningful part about my job.